Okay, this chapter is the endocrine system, and we're going to see that cells have different ways to communicate to each other, with each other, and that's what you see right here. Gap junctions, neurotransmitters in the case of the nerves, paracrines, and hormones. So in this chapter, we need to cover hormones because in the endocrine system, the glands are going to produce hormones. So which ones are the glands that we have in our system? In general, we're going to see this with more detail later on. We have, for example, the thyroid gland, the thymus, pancreas, ovaries, testicles, and you can see here that you have the diencephalon and the pituitary gland. A little bit bigger, same thing. Diencephalon, in this case, the hypothalamus of the diencephalon is right here. The hypothalamus is very important. And then you have the pituitary gland right here. Okay, we're going to see that with more detail later on. So if we keep scrolling down, we can see the comparison between endocrine and exocrine. Exocrine glands secrete the contents that they produce to the exterior using a tube or a duct, and the endocrine system, the contents that they produce, they release it to the blood. Comparison with the nervous system, they show it in here because these two systems are going to be used in order to control everything that is going on in our body. They are not redundant, but rather they complement each other. They work together in order to control everything that's going on in your body. You have a nice table right there comparing these things, but it's enough to say that the nerves are going to use neurotransmitters, as you know, and the endocrine system uses the blood in order to release the hormones. And that's about it. Next, we have this table that I'm not sure why is there, because you will learn the names of all the hormones little by little by studying this chapter. So we just gonna skip this piece until we cover all these hormones in detail. So the next topic is the hypothalamus and the pituitary gland. You can think about this like the military. The hypothalamus is the captain, the pituitary gland is the sergeant, and all the other glands like thyroid glands and testicles and ovaries, they're going to be the soldiers. So the hypothalamus, the captain, calls the shots. The pituitary gland receives the information from the hypothalamus. And the pituitary gland, the sergeant, is going to disperse this information to the other glands. So how does that happen? Because the hypothalamus is going to release hormones to tell the pituitary gland what to do. How the pituitary gland tell all the other glands, in other words, how the sergeant tells all the other soldiers what to do with hormones as well. So that's what we need to understand. So there's a kind of like a rank in here. This is the captain, this is the sergeant, and all the other glands are going to be the soldiers, and all of them are going to communicate with each other. You're releasing hormones. So anatomy, we're going to see that there's a close relationship, as I showed you before, between the hypothalamus and the pituitary gland. Hypothalamus is part of the diencephalon and is on top of the pituitary gland, as you can see right here. The pituitary gland sits on this bone. This bone is the sphenoid bone, and this part of the sphenoid bone is the sella turcica. That's where the pituitary gland is going to be sitting. As you can see here, pituitary gland has two colors because the pituitary gland has two areas: anterior pituitary, or adenohypophysis, and posterior pituitary, or neurohypophysis. We're going to see that in a little bit. So we scroll down, and we can see here again the two pieces right here. You can see this is the brain, diencephalon, hypothalamus part of the encephalon, and we have in here the pituitary gland. We said the pituitary gland has two parts. So how the hypothalamus, this part right here, communicates with the posterior lobe or the posterior pituitary? It does it using nerves. Basically, these nerves are going to produce two hormones, oxytocin and antidiuretic hormone. They release them and they are transferred to the posterior pituitary where these two hormones are stored. Oxytocin it's a hormone that is going to work at the level of the uterus when the pregnant lady is about to deliver the baby. So it stimulates the contraction, the uterine contractions to deliver a baby. Okay. The next one is the antidiuretic hormone. Antidiuretic hormone is used to retain water. Diuresis means urination. Anti means to avoid. So then this means, for example, anti-urination. So if you don't urinate, you keep more water in your body. Therefore, you increase the levels of water in your blood. And if you increase the levels of water in your blood, for example, you can increase the volume of blood, like, for example, to increase blood pressure. Okay, so then we have that the hormones in the posterior pituitary are going to be oxytocin and antidiuretic hormone. How these hormones get here? Through the nerves. But now if we look at this other figure right here, We covered the posterior pituitary. Now we look at the anterior pituitary. We can see that the anterior pituitary, we don't use nerves, but rather we use blood vessels. That's why you see here blue and red. So then the way that the hypothalamus, this part right here, communicates with the anterior pituitary is with blood vessels. How? We said this is the captain, this is the sergeant. How the captain and the sergeant are going to communicate with each other? Using hormones. So then, what are the hormones that you are going, that the hypothalamus is going to release? You have them right here. We're going to see that with a little bit more detail. Not only that, but this figure is also showing you the hormones that you're going to release from the anterior pituitary. So there are two sets of hormones, the ones from the hypothalamus and the ones that you're going to release from the pituitary gland. Okay, so let's keep scrolling down. Right here, you have a nice figure showing you that, in fact, yes, this is a pituitary gland, but you can see even in the histological view that they are two completely different structures. This is the neurohypophysis, this is the adenohypophysis anterior pituitary, and this is posterior pituitary. So if we keep scrolling down, we can see here the hormones that are released by the hypothalamus. We said the hypothalamus is the captain. This one calls the shots. And is going to talk to the pituitary. What part? Anterior pituitary, for example, if we talk about the blood. So then how the hypothalamus communicates with the pituitary? With hormones. So then what hormones the hypothalamus are going to release in order to control the pituitary? That's what you have right here. It is going to release thyrotropin releasing hormone that is going to stimulate the release of TSH, as you can see here, and prolactin by the pituitary gland. It also produces corticotropin releasing hormone, CRH. Okay, this is from the hypothalamus. What the pituitary is going to do is going to release adrenocorticotropic hormone, which is ACTH. What else? Gonadotropin releasing hormone, GnRH, is released for the hypothalamus in order to stimulate the release of FSH and LH. Growth hormone, GHRH, growth hormone releasing hormone, obviously is going to promote the release of growth hormone. Prolactin inhibiting hormone, PIH, is going to inhibit the release of prolactin by the pituitary. And somatostatin released by the hypothalamus is going to inhibit the release of growth hormone as well as TSH by the pituitary. So if we scroll down, we can also see in here the hypothalamic hormones, but in the posterior pituitary. So we already mentioned that they are going to be what? The antidiuretic and the oxytocin. I already talked about them. So if you want to know these hormones, I mean, this table right here would be enough for you to learn the different functions of the hormones released by the hypothalamus and how they work with respect to the hypophysis or pituitary gland. And right here you have the ones from the posterior pituitary. So we already covered that. If we scroll down, action of the anterior pituitary hormone. So what are the hormones that we have in the anterior pituitary? And well, I already mentioned this in the table when I was explaining the hormones released by the hypothalamus, but you can see here that you have FSH, LH, TSH, ACTH, prolactin, and growth hormone. And you have a nice table right here that should be enough for you to understand and learn which ones are the different hormones that are released by the anterior pituitary as well as the posterior pituitary. Not only you have the names of these hormones, but where do they work and the functions that each one is going to have. So you better make sure to know this because this is probably going to be important for the date of your test. So we keep scrolling down, and in here you have the same thing, but using a drawing. So you have in here the hypothalamus. The hypothalamus is a captain. How the captain communicates with the sergeant? Using hormones. So let's use this one, the one in green. So the hypothalamus releases gonadotropin releasing hormone. As a consequence of that, the anterior pituitary is going to release this one in green, which if we scroll down, we are going to see that they are going to be LH and FSH. And LH and FSH are going to work at the level of the ovaries and the testicles, for example, to stimulate the ovulation and to stimulate, for example, the release of testosterone. We're going to see that with more detail later on. So we keep scrolling down. Posterior pituitary, we have the antidiuretic hormone and oxytocin. We already mentioned that. Control of pituitary secretion, obviously that is done by your brain. What part of your brain in particular is going to be the hypothalamus. We said the hypothalamus controls everything in your body with respect to hormones. And how the target organs, in this case the other glands, are going to respond to that. Most of the time that is done with a negative feedback. So Hypothalamus releases, for example, TRH. As a consequence of that, the pituitary gland releases TSH. As a consequence of that, what's going to happen? The thyroid gland is going to release thyroid hormones. When there are enough thyroid hormones, this increase in thyroid hormones is going to provide a negative feedback to the pituitary gland as well as the hypothalamus, so they don't produce TRH and TSH anymore. This is actually called negative feedback. So if we scroll down, then we're going to get to this part which says a further look at growth hormone. The reason why this in here is because we need to explain a little bit more how the growth hormone works. So for example, when we grow, our right arm is not the one that grows the longest, right? It's not a very long arm and then all the other limbs in our body are shorter. No, because it's not just that the growth hormone stimulates the growth of one particular area of your body, but it's going to be a symmetrical and overall growth of your entire body. So then how a hormone can have an effect of your overall growth in basically working every single tissue and organ in your body? Well, it doesn't do it specifically with one thing, but rather it works directly with the metabolism in your body, with the metabolism of everything that we are going to consume. Because if you are going to eat, everything that you eat is going to be used in order for you to grow. So that's why if you look in here, you can see that the growth hormone is going to work in the metabolism of proteins, lipids, and carbohydrates by making sure that you have these things ready in order to grow. So again, if everything that you eat is processed and is metabolized and is ready to do everything that needs to be done, then your body will work symmetrically. Your body will work in a way and will grow in a way in which everything in your body will be symmetrical and not just one part will grow. So that's why you can see here that the growth hormone works in everything, basically in all the organic compounds that we're going to eat, making sure that they are ready for us to grow. Not only that, it also works in electrolyte balance for very important ions such as sodium, chloride, and potassium. The next thing that you need to know is that the growth hormone by itself doesn't last too long. It lasts, I think, 5 to 10 minutes, no more than that. And then what happens then? 5 to 10 minutes of growth hormone will not be enough for you to have an effect in the entire body. So therefore, the growth hormone, in addition to working with all these proteins and carbohydrates and lipids for us to grow, it also works in the liver, stimulating the production of insulin-like hormone factors, which are these ones, IGF-1, IGF-2, or somatostatin. That's another name for that. These somatostatin are going to enhance the work of growth hormone. And not only they enhance the work of growth hormone, these somatostatin last in the body approximately like 20 hours. So not only it goes from minutes that the growth hormone can work, it will go into hours that the somatostatin can work. So very important concept to understanding is half-life. This is something that you're going to learn in pharmacology if you cover that, which is the time that takes your body, in particular your liver, to get rid of substances such as, for example, growth hormone. Right, and it takes 5 to 10 minutes. Well, right here in your book says 6 to 20 minutes, right? And you can see here 20 hours for somatostatin. Okay, so then this is not enough in order to make you grow, right? It's just not enough time. But by stimulating the production of somatostatin or IGF-1, IGF-2, then you have a lot of hours in order to be able to process and work with all these different proteins, carbohydrates, and lipids, as well as electrolytes. Okay. Okay, so let's keep scrolling down, and that is it.